So we teach people living with all forms of diabetes how to transition to a low-fat, plant-based whole food diet so that they can reverse the underlying cause of high blood glucose, which is insulin resistance, and simultaneously also reverse many of the complications that come along with diabetes, including chronic kidney disease, fatty liver disease, peripheral neuropathy or nerve pain, as well as unwanted weight gain.
Okay, so let me ask you this. I saw that you have an internet-based program, right?
Correct.
You do some personal coaching through video chats, and then you also have a retreat in Costa Rica.
Correct.
Okay, so let me ask a question. Somebody comes down to Costa Rica, they show up with end-stage renal disease, they're close to dialysis. Tell me about your diet in that situation.
Okay, so another thing that I'd also like to say is that we also have a medical doctor on staff as well. And the medical doctor on staff is there to make sure that everything goes safely and that there's no medical emergencies. So if somebody comes to us with end-stage renal disease, stage 4 chronic kidney disease, the recommendations are to eat a diet that's low in sodium, that's low in phosphorus, and that's low in potassium.
Yes.
Right? And so what we're gonna do is we're gonna work with that patient, and again, under the supervision of our medical doctor, we're gonna make sure that they're able to control their blood glucose again in the short term and also not pose a risk for their kidney function in the long term.
I think there are some really wonderful things about your all's approach here. And I think you keep saying whole food, plant-based, and I am all about that. I also echo some of your concerns, Dr. Pinzone, which is I've learned a lot in hosting the show in 12 years, and I've learned that the way certain people react to certain diets, I'm all for whole foods regardless. I think that you have to make sure that if you're going to engage in any program like this, I agree. You have to do it in concert with your endocrinologist. Make sure everyone is on board. Diabetes, type 1 diabetes and type 2 diabetes are very complicated, potentially, depending upon the patient. And I really applaud you two for taking your health into your own hands and making this your life's passion. But I just do not want to oversimplify this. As you guys both know, some people do really well with diabetes, others not so well. And I think focusing on food as medicine is important. Cyrus, Robby, I really appreciate you two sharing this with us. Dr. Pinzone, we always appreciate the work that you do and taking great care of your patients. We're going to have more information about this on our website, but I think we can all agree. We've said it over and over on this show. Whether you have diabetes or not, the more you can limit these highly processed foods that we continue to eat in this country, the more you're going to reduce the potential side effects and calamities from all of the major killers out there, whether it be diabetes, heart disease, the list goes on and on. So think about that tonight. Maybe you can make one small change tonight. Stop. When you're maybe gonna reach for a candy bar, eat something, some whole plant-based food that can improve your health regardless of what you're dealing with.